Let's talk about neuropathy. Neuropathy is the inflammation of the nerves. It usually happens to your hands and feet. It's called peripheral neuropathy. The reason it happens to your hands and feet is because the circulation to your hands and feet are compromised by different kind of reasons. And there are different kind of neuropathy. There are diabetic neuropathy, chemo drug-induced neuropathy, alcohol-related neuropathy, or glucose intolerance-induced neuropathy. But if you think about the inflammation of the nerves and the degeneration of the nerves, and it's all related with poor circulation. So anything causing the compromise of the blood circulation to the peripheral nerves will potentially cause neuropathy. So if you drink too much coffee, it can constrict the blood vessel in your hands and feet. Too much alcohol, causing the inflammation of the blood vessel, and eventually cause the inflammation of the nerves. And also even sugar substitute are toxic to the peripheral nerves. But the good thing is the peripheral nerves can regenerate. So if you eat the right food, you have sufficient vitamins and minerals, and you improve the circulation to your hands and feet, then the peripheral nerve can gradually regenerate. So why older people develop neuropathy much more frequently than younger people? Because the regeneration of peripheral nerves in older people are slower. So if you speed up the degeneration, then eventually the peripheral nerve will lose part of the function. And then you will feel tingling, burning, or pins and needles, or your muscle get atrophied. You have no strength to walk or hold things. So we have to improve the circulation to your nerves and clear up the inflammation of the nerves and blood vessels. And studies shows acupuncture can help reduce the inflammation and speed up the regeneration of the nerves. This Chinese scientist recruited 60 patients, and 30 patients are randomly divided in each group. So in medication group, there is 30 people, and in acupuncture group, there is 30 people. In acupuncture group, those 30 patients will get acupuncture treatment with electric stimulation connecting to the needles every day for 30 minutes. And for 10 days, that's one course. And then patients take a 2-day break. Then they will do another 2 courses. In between, there is 2 days break. And that adds up 30 acupuncture treatment with electric stimulation. On the medication group, they will get IV medication for 10 days, take 2-day break, and get another 2 courses. Then they compare the peripheral nerve score, and they find both groups have lowered peripheral nerve score, which indicating reduced inflammation. But the acupuncture group has more significant reduction in the score, meaning the inflammation is reduced more significantly in acupuncture group compared to medication group. Then the scientists also measure the sensory and motor nerve conduction velocity. That's the function of the sensory nerves and motor nerves. And they measured these 2 kinds of nerve function in median nerves which distributed to your arms and hands, and also common perineal nerves, which distributed in lower legs and feet. And interestingly, both groups have improved sensory nerve and motor nerve conduction velocity. But in the group in the common perineal nerve, the nerve, sensory nerve, and the motor nerve conduction velocity improved much more significantly comparing to the medication group. While in the median nerves, both groups have the improved nerve function, but only motor nerve conduction velocity are more significantly improved in acupuncture group compared to the medication group. So this study indicates that improving the circulation to your legs and feet are much more important than improving the circulation to your hands, because thinking about how far away your lower legs and feet away from the heart, and both hands are much closer, and plus you always use your hand while you are sitting there to do the work. Your feet and legs have reduced the blood circulation. So by doing acupuncture treatment, you have to lie down for 30 minutes every day for 10 days, and that itself can improve the circulation to your both feet and legs. So that's why some people have better result with acupuncture, other people have poor result, because some people will do meditation or take a nap every day for 30 minutes by lying down and combining acupuncture treatment. That will dramatically improve the blood circulation to your legs and feet. And also, those people could eat more nutrients and more healthier food comparing the other group. And the other factor is, if you only do acupuncture once a week and you currently have severe peripheral nerve degeneration, it's not going to work as well as you have 3 times or at least twice a week for 3 courses of treatment. So good nutrients, good rest, and sufficient dosage of acupuncture plays key role in speeding up the regeneration of the peripheral nerves, so you can have better result